thank you all for being here today. We really appreciate you coming and coming to the benefits fair and supporting it. So thank you. We're going to be talking about the open enrollment changes. We're going to be talking about the health savings account, the flexible spending account, the medical, the dental. So we're going to be going over all of that. We have myself here from the Benefits Department, Stephen from National Benefit Services, and Elizabeth from Regents. So open enrollment officially started on Tuesday. It is going through the 24th of May, which is a Friday, right before Memorial Day. So on your calendar, when it says last day of work before holiday, it's also last day of enrollment. It makes Christy really happy if you make changes before the 24th. So if you want to make changes, you've got now until the 24th. If you don't do anything with your medical, your dental, or your vision or life insurance, they will all stay the same. So no changes on your vision, medical, dental, life insurance, they will stay the same. And then any change you make during open enrollment period takes effect on July 1, which will show up on your July 22nd paycheck. So things about open enrollment that you need to do. If you have a flexible spending account, a flexible spending dependent care account, or you want one of those accounts, make sure you re-enroll in those. Those do not roll over every year, so you have to re-enroll in those. Those are done online. I have an instruction page that's NBS online enrollment on the HR page. That's step-by-steps that tells you how to enroll. If you run into problems, let us know. You can also do the paper form if it's just not working, so we can get you squared away. You can also change your medical, your dental. You can change who's on your medical and dental. Your HSA, if you don't already have it and you want to enroll in it, you'll need to enroll. If you already have it, you don't have to do anything to let it roll over. It will just go automatically. And then the life insurance, you can do that one on paper. That's the only one you have to do on paper. The rest of them are online. I also have the links and for the life insurance enrollment form on the HR page. They're also at the Securian table at the benefits fair. So new things happening for the next fiscal year, July 1 to June 30th. The yearly maximums for the flexible spending account and the health savings account have increased. So the flexible spending account IRS maximum for the year is $2,700. For the HSA for individual coverage, it is now $3,500 between you and the employer, and for family, it's up to $7,000 on the HSA. So right now, you're paying the flexible spending account and the health savings account administration fees, which is $1.50 a paycheck for the FSA, $1.43 for the HSA. So starting July 1, the college will pick those up, so you won't have that deduction on your paycheck anymore. And then we're also changing how we're putting money into your HSA. So right now we put $50 a paycheck into your HSA. We're going to change that. So if you have single coverage with the HSA, we are going to put the $1,200 in all up front, which will show up on the July 1st through 15th pay period on the July 22nd paycheck. So it takes a few days for it to get from payroll loaded all the way into NBS's system and show up into your account. So if it's not there right on the 22nd, just wait a few days and then it should show up. And then if you have two-party or family coverage, it's going up to $1,600. So that is what the college will put in July 1st through 15th pay period for two-party or family. Also, the co-pays on your medical have decreased, which, I mean, how often do you hear they're decreasing? This is great. Your office visit copay, the amount you pay when you go into an office visit, like your primary care right now is at $35. It's going down to $25. Specialists are $45 right now. They're going down to $35, and urgent care is at $50 at the moment, and then it's going down to $35 as well. And there are no changes in your medical or dental premiums. The amount that comes out of your paycheck, those are staying the same. We had a great year, so thank you. And then just a reminder that the eye exam is just on the vision insurance. In the past, it was on the medical plan. It's right now and going forward, it's just on the vision plan. So the college pays the premium, the amount that comes out of your paycheck for you to have the vision coverage as well as any dependents you enroll. So if you haven't already enrolled your dependents, make sure to enroll on EMI Health's website for it. And then it's free for the premium to add them. And then the injuries to eyes, those will stay with the medical, but the eye exams are with the vision. And then if you want help enrolling, you're welcome to enroll on your own. If you want someone to sit with you and help you enroll, myself, Patty, and Brandon will be at the library on May 19th and May 17th on the second floor in one of the computer labs to help you enroll, sit with you for like a flexible spending, to enroll in HSA, change your medical and dental, vision, all those things. So next we're going to have Stephen from National Benefit Services talk to us about the HSA and the FSA, the dependent care. Do you have any questions for me before we go forward? Okay, then now we have Stephen.
Okay, like Christy mentioned, with the HSA contribution, there's going to be a change with that. So instead of the pro rata amount of $50 a paycheck, you're going to get a lump sum contribution. So if you're doing single, the total amount will be the same, the $1,200. If you're doing two-part of your family, you're going to get an increase of $1,200 to $1,600, so $400 increase. And again, that will be deposited at the latter part of July, so just keep that eye on that. So HSAs, if you don't have one currently, you can use one to pay for medical, dental, and vision expenses that you incur out of pocket, so anything that the insurance doesn't cover. The funds are only available as they're deposited. This is different from the Health FSA where you have the preloaded account. So it's just like your savings or checking account. If there's money in there, you can use it. If there's not, you'll have to wait. Funds do roll over from year to year, so this is also different from the Health FSA. You don't have the use it or lose it rule. If you want to put the full $7,000 in your HSA and you don't spend any of it, then you can use it next year, 3 years down the road, 10 years down the road. Flexibility in funding, again, this is another distinction from the FSA. You can change contributions into the HSA at any time, so if you have an unexpected non-medical expense you need to take care of in the next few months, you can stop or reduce your HSA contributions you're putting in. On the flip side, if you have a medical expense that you know that's coming up in the next few months, you can increase or start making HSA contributions out of payroll. And you can also enroll in the HSA when you're eligible, so if you're covered by a spouse's traditional plan currently and are planning on going on to or you have an FSA that's through the calendar year and you want to start making HSA contributions in January, you can certainly do that. So who's eligible? So this is an employee. So I had someone come talk to me right after the presentation. So if you have a spouse or dependent that has non-qualifying coverage, that won't impact you as long as that coverage doesn't, as long as you're not covered by that coverage. So you have to be covered by a high deductible health plan. You can't be enrolled in Medicare or Medicaid. Again, if a spouse or dependent is enrolled in that, that's fine as long as you're not enrolled in it yourself. You can't be covered by other health insurance, including TRICARE, VA coverage within the last 3 months, or a traditional plan through a spouse. And finally, you can't be another person's tax dependent, so if someone else is claiming you on their taxes, then you would not be able to make HSA contributions for yourself. So expenses, you can use the HSA, so you can use it for yourself, your spouse, and any of your tax dependents. And please note the difference between someone that you can claim or cover with your medical insurance is different than who you can use your HSA for. So if you have a child that's covered by your high deductible health plan, that does not necessarily mean you can use HSA funding on them. And also, on the flip side of that, so if your child is covered by a traditional plan, say they have a job that gives them medical coverage, you can still use the HSA on them, even if as long as they're a tax dependent of yours. So even though they don't have the same coverage, don't have a high deductible coverage for themselves. Some common FSA and HSA expenses, so any of your doctor or hospital visits, medical equipment, chiropractic care, dental or vision care, so anything that your dental or vision insurance doesn't cover, prescription medications, the HSA, you can use it for non-qualified medical expenses, but it is a very, very expensive way to pay for them because you will have that money treated as taxable income when you file your taxes. And on top of that, any non-medical expenses will be hit with a 20% tax. So it can be very, very expensive to do that. I would not recommend it unless it's your only option. So things that are not considered qualified. So health insurance premiums are generally not eligible for either FSA or HSA. They are never eligible for FSA. For the HSA, it may be for certain things. Probably the most common is most Medicare premiums. If you have a question about that one in particular, come talk to me. There's some nuances with that. Over-the-counter medication generally is not allowed unless it's prescription. Insulin is the one exception to that, so you can purchase insulin without having a prescription. Cosmetic procedures aren't eligible. Expenses covered by insurance, again, basically no double dipping. If you get reimbursed from your medical insurance, you can't turn around and pull that same money out and from the HSA or FSA. And then general health items, probably the most common one there is gym membership. So if you want to go to the gym to improve your health generally, that won't be allowed. If you have a prescription from a provider stating that you need it for a medical condition and you're not currently going to the gym, the only reason you're going to the gym is because of the prescription, then you would be able to have that reimbursed. So again, kind of just another quick recap of HSA versus FSA. HSA, again, funds are available as you put them in. It's just like your savings or checking account. You must have a high deductible health plan, either through SLIC or through someone else. Another great perk with HSA is no adjudication required, so we're never going to request documentation from you if you have an HSA. Please note, though, that the IRS may audit you, and then if they do, they will require that documentation. So you'll still need to get it. You just probably won't have to submit it to us. And then probably the best perk about HSA is no use it or lose it. So again, if you put the full $7,000 in there, don't use any of it, you'll still be there next year. FSA funds are available July 1, so if you want to put the full $2,700 in there, you can have $2,700 available July 1 if you need it. Medical coverage doesn't matter, so if you have a traditional plan, Medicare, Medicaid, VA coverage, any kind of no medical coverage in theory, you can have the FSA. Adjudication is required on all expenses, so please keep that in mind. You'll need to give receipts, and we'll be reaching out to you to have those provided to us. And then probably the biggest drawback with the FSA, unused funds are forfeited at the end of the year. So if you only elect what you plan on using if you're going with the FSA, because if there's funds left in there, you're going to lose them. Debit cards, so if you have a debit card from last year, it will work for both benefits, both the FSA or HSA. So if you're switching from one to the other, just keep that card. Funds are going to be loaded on July 1 with the FSA, and again, the HSA is only going to be as we get funding from the SLIC. Question?
There used to be a fee to have that debit card. Is there still going to be a fee?
So SLIC is picking up the fee.
Well, that's the administration fee, but like the fee to actually have the card, carry around the card.
Could you repeat the question? Sorry, that just for the camera. So I'm going to repeat the question. Sorry. Okay, sorry about that. So she asked is there still going to be a fee for the debit card? So the debit card, there is a fee, but you will not have to pay it. SLIC is going to be picking up the fee for the debit card. So you won't be seeing on your pay stub the $1.50 or the $1.43 fee anymore. That's going to go away from your perspective.
Okay, I guess I'm confused because I don't have a debit card and I didn't get it because I didn't want to pay the fee, and I've been charged the $1.50 fee for the last 3 years.
Okay, I
So
think
I thought there was two separate fees, like an administration fee and then a fee to have the card. Or am I?
I think there's just the admin fee. There's just the admin fee. So, yep, that's from your perspective, the admin fee will be going away.
Okay.
So the health FSA, tax savings on all medical, dental, and vision expenses. The maximum contribution again is $2,700, so a small increase from last year. And again, funds will be loaded at the start of the year. So if you elect the full $2,700, you'll have $2,700 to spend. In addition to the health FSA, there's a dependent care FSA. Please note that this is not a health FSA for your dependents. This is for daycare or preschool expenses. So if you have any of those expenses and you incur them in order for you and your spouse, if you're married, to be gainfully employed, then you can use those expenses you can get reimbursed from those expenses on a pre-tax basis. It's very similar to the HSA in that funds are only available as we get them, so it's not like the FSA where it's preloaded. So if you have more than, if you have several $100s worth of expenses every month, and we don't have money from SLIC yet, we won't be able to reimburse the expense. So keep that in mind. You can set yourself up on continual reimbursement. That's probably the easiest method for dependent care, where you submit the continual reimbursement at the start of the year, and then we'll pay you out as we get funding from SLIC, and then you'll submit documentation at the end of the year. Online enrollment, so like Christy said, there is, if you go to the HR page, that's probably going to be your best bet for all of your enrollment needs. You can go there and have the step-by-step instructions. If you've logged in previously, you can log in just go to our website where you log in and go to the bottom where it says enroll here, and they'll walk you through the process. You'll just log in like you're logging in to get into your account, and it'll get you to where you need to go. The mobile app, so most of you probably will use the card for most of your expenses, but the mobile app is a great way to submit receipts if we request them. Also to order additional cards if you need to, and also report if a card's been lost or stolen. You can always feel free to call the number in the back of your card if that's the way you want to go, but I feel like a lot of people are kind of moving towards mobile apps just for the convenience factor. And that's pretty much it for me. Is there any additional questions on FSA, HSA, dependent care? Okay, we'll be at our booth. Thank you so much.
All right, next up we have Elizabeth from Regents, and then we'll also have at the end Laura from Livongo.
Good morning, everybody. We should take this outside. It's so beautiful, right? Okay, so let's talk medical and dental benefits. You've had some good news, and I like presenting good news, especially with healthcare. It doesn't happen very often, so enjoy it. Let's talk dental first. There's no changes. It's a great network. You have a lot of providers. You also have coverage out of state, so if you have somebody out of state, make sure they have a card. If you want to look for providers, regents.com or the app is going to be your best bet. Like I said, it's a large network, but make sure you go to in-network provider for the best benefits. And again, there's no changes to premiums. This is your per paycheck premium. No changes again, so great news. Medical rates, again, I'm going to sound like a broken record. No changes, no increase, and that's unheard of. Participating is the most expensive network, the very top one. It has all the hospitals in the state. The next one is Preferred Value Care. It's also a very large network, but it doesn't have the IHC hospitals. And the least expensive is the Preferred Focal Point. If you're single and you have the high deductible plan on the Focal Point network, you have zero premium. Okay? HR has a little sheet with the premiums if you're not sure, but they're staying the same. So great news. Online enrollment. HR has the website to go to do your online enrollments. Please don't wait until May 24th to ruin your Memorial Day weekend. Do it as soon as you can. Look at the benefits, compare, ask questions. If you have a username and password from last year, just use the same one. If you're a new user, you do have to set up a username and password. If there's any issues, there's a phone number to call. Here's a screenshot of the website. You're gonna log in and then click on benefits and then open enrollment, and make sure you get the message that your enrollment was complete. That way you know everything is taken care of. Okay, online enrollment, you can maintain your personal information, you can compare plans, you can link out to all the different vendors if you want to take a look at medical, life insurance, vision, so everything is on there, so just take a look. You can manage your account information. Okay, let's talk networks. How many networks does SLIC offer? 3, yep, absolutely. So you have 2 plans, and on top of that, both plans, you have 3 networks to pick from. The first one, the most expensive, is the participating network, has all the hospitals in the state, almost 13,000 providers. It does include Primary, Huntsman, and University of Utah. It has all the urgent cares in the state, And you have access to Blue Card, which is out of the state and also out of the country. You have access to all the surgical centers in the state except for one, and it's the Cottonwood one. Okay, that's your first network. The second one is Preferred Value Care, also a very large network, 41 hospitals, almost 13,000 providers, includes primary Huntsman, University of Utah, has all the urgent cares, even the IC urgent cares you can access. It's just the facilities that are not in this network. You access a very large network out of state. You have access to a PPO network. And again, you have access to all the surgical centers except for that one. And the last one, but not least, Focal Point. This one is the narrow network. It's all just along Wasatch Front, 13 hospitals, close to 7,000 providers. It does include primary Huntsman, University of Utah, and you do have access out of state. You actually connect to the same network as Preferred Value Care when you go out of state. It's called PPO. If you're on the high deductible plan and you pick Focal Point, there's no premium. Again, it's a great option if it works for you. I have a really good list at the table at the fair where it shows you the hospitals side by side. Providers are individually contracted. They can be contracted with a participating network, but the hospital that he's doing his surgeries could be out of network. But many times they can do surgeries at different hospitals, but they're individually contracted. So just so you know. Any questions so far as networks? You can search for providers, regents.com, the app. If you want to go to a new provider or if you want to switch network, you can check your providers before you switch to make sure they're in that network. If you logged into the website, it's only going to pull in-network providers. If you can do a guest search, just look for these networks. Okay? Okay, like I said, you have a great network, 92% of physicians, 96% of hospitals. If you are traveling out of the country, I recommend going to bcbs.com. There's a phone number to call if you need to travel. They even have an app because we do have a network out of the country. So call the number if you need to seek services if you're in a different country. If you have to pay for services up front, make sure you get an itemized receipt. And there is a claim form on bcbs.com you can just fill out, and it will process towards your benefits. Just make sure you get an itemized receipt with all the charges, the codes, provider information, and so forth. Okay. Surgical centers are a great option if you can have your surgery there. This is just a comparison of the cost. There's a big difference. Facilities are going to be more expensive, so if you can have your surgery there, that's a great option. You can search on regents.com, and it will give you a cheaper option. You can look at member reviews if you're not sure if you want to go there, but definitely take a look before you schedule your surgery. There is lots of options, and there's actually a big difference between facilities as far as costs. You'd be surprised. Okay? Any questions? No? Okay, let's talk benefits. Okay, this is a summary of the traditional plan. There's no changes. It's the lower deductible, the $400, $800 for a family. The total out-of-pockets is the same, $32, $6,500 for family. Pharmacy has a separate deductible and separate out-of-pockets. Remember that. The best benefits are going to be staying in-network. Out-of-network is available, but it's a separate deductible and separate out-of-pockets. But there's no changes as far as the amounts on the traditional plan or the high deductible. And the good news is the copay are going down. So if you're on a traditional plan, the copay is going to be $25 for a primary care physician and $35 for a specialist or urgent care. You will get a new card in the mail because of this. Your old card, you can still use it. But make sure when you go to your provider after July 1st that you show them your new card so you don't have to pay the higher copay. So that's good news, right? I do want to mention at the bottom, you have access to telehealth through MD Live. It's only a $10 copay. I do urge you to download the app, MD Live. You can go to the App Store or you can register through regents.com or our app. If you do an open enrollment, register with your ID number, you can win a Fitbit or a gift card. So, and again, it's a great option that's available, so take advantage of it. Okay, Magellan RX is still going to be the pharmacy vendor. For the traditional plan, there's no changes. Do keep in mind it's a separate deductible for pharmacy, but the copay stays the same. Okay, now on to the high deductible plan, which is the cheapest one of the two plans. The deductible is the same, $1,500 for single, $3,000 for family. Just keep in mind that if you're on a family plan, you don't have a single deductible. You have to meet the full family deductible. So you're either single or you're on a family, but you don't get to do the single deductible if you're on the family deductible. You have to meet the full family deductible. Just keep that in mind. But there's no changes. Again, best benefits are going to be for in-network. And just a reminder, July 1st, it resets, and then it goes to next year, June 30th. Okay. High deductible, the copays are going to be lower on the high deductible as well. Just remember, they're going to be after deductible. You have to meet your deductible first, and then the lower copays will kick in. Okay. You also have access to MD Live telehealth on the high deductible plan. If you haven't met your deductible, you will pay the full cost, but it is really cheap. It's $42 for a medical visit, $75 for a mental health. So yeah, it's great. You can use your HSA account to pay for the copay. If you met your deductible, it's just going to be the $10. But you do have to register because it will bring in the correct copay when you use your ID number. Okay. Okay, pharmacy on the high deductible works a little bit different. It's the same medical deductible you have to meet before we pay for prescriptions. So other than that, the copay stays the same, but just keep that in mind. You can use your HSA account, but you have to meet your deductible before we start paying.
Your medical deductible, not separate medical.
Correct. Correct. So on the high deductible, it's one deductible for medical and pharmacy. Good question. But, so you have to meet your deductible on the high deductible for any medical procedures, but preventive is still covered at 100%. If you go for your checkups, your mammogram, your colonoscopy, that's covered at 100%. There is a list on regents.com, exactly the guidelines, what's covered at 100%. We follow healthcare reform. If you want to take a peek, there's a full list of vaccinations and all the checkups and all the preventive screenings that you can do without deductible. And also, if you're on a chronic condition, if you have a chronic condition, we have a list called Optimum Value List. If your drug is on there and you're on the high deductible plan, you don't have to meet the deductible. You only pay the 10%. So this is just an example: depression, diabetes, asthma. So yeah, I have the list at the table if you want to take it, or it's online as well. So preventive and this optimum value list, you don't have to meet the deductible. And preventive is 100%, and this list is only 10%.
Now, when you make the high deductible and you want all of the hospitals in the state, which is the premium insurance, are they one and the same, or are they separate?
So you're asking if the high deductible and the participating network goes together, or if they're separate?
No, if you choose the premium
The high deductible plan?
plan,
Uh-huh.
not the high deductible plan, it's usually
The participating?
you choose the 100% all the hospitals
Mm-hmm.
plan.
Uh-huh.
Okay? And you choose the high deductible also. Are those actually one and the same? If you choose the high deductible, you automatically get the premium plan?
No, so his question is, if you pick the high deductible plan, do you automatically get the participating network? So you have two plans to pick from. You pick the plan, then you pick the network. And all three networks are available for both the traditional plan and the high deductible plan. You pick the plan, but it's up to you if you want to have access to all the hospitals If you're fine with focal point, if you're fine with preferred value care where you don't have IHC, it's up to you. So that network goes on both plans. Does that make sense?
Okay, well, let me give you a specific.
Yeah.
I had to have a kidney transplant, and there's only 2 hospitals in Utah that do that. And I went to the IHC hospital, and so I had to have the premium plan for you at that particular point, but I still paid the high deductible on it,
Mm-hmm.
even though I chose the lesser deductible.
Yeah. You can pick any network. If you have to have the participating network with all the hospitals, you can. Absolutely. But you can have the high deductible with the participating, preferred value care, or focal points.
But you could have had the lower deductible with
Uh-huh.
the premium plan.
You can have the lower deductible traditional plan with participating, preferred value care, or focal point network. Does that make sense?
Yes. After the fact, no, but.
Yeah. Yeah, I mean, hopefully you don't pick a plan based on a hospital. I'm on the preferred value care, and I'm close to an IC hospital. If it's emergency, we pay the same in and out of network. That's healthcare reform. If you get balance billed by a provider that's not in the network, call customer service. There's a process in place to see if we can negotiate the charges. So, you know, make a good decision. I mean, if you're having a procedure and you have to go to a certain hospital, by all means. It is a personal choice. Pick the right network for you. But definitely take a look at it because there is a cost. There's a difference in cost. Okay, so here's a plan comparison between the traditional plan and the high deductible plan, just to give you an idea, the annual premium. So yeah, definitely take a look. This is your chance to look at the plan. Is it working for you? Could I change? Could I go with a high deductible? Could I go with a different network? So this is your chance, and you have a long period. Open enrollment is long, so you can think about it, but don't wait until last day. But in this case, you can see that the HSA money that the SLIC gives you is definitely a benefit on the high deductible. So take that in consideration when you pick your plan. Here's an example of a single person who has $2,000 in medical expenses, and the total out of pocket is $720 on a traditional, $1,550 on the high deductible plan. But because you can use the money that SLICs give you, and they're very generous, you can use your HSA account to pay for it. It's actually cheaper on the high deductible plan. So just think about that. That's just one example. Here's another example. This is a family who has $35,000 in medical expenses. The member total is $6,500 on the traditional plan, $6,000 on the high deductible plan. But when you can take the $1,600 that SLIC gives you, it actually comes out to savings. You're actually saving money, but you know, on the high deductible plan, using the HSA money. And you can put in money too, if you know you're having a procedure. Christy's going to put this PowerPoint on the website if you want to take a look at it. These examples are great to look at, so make sure you make the right decision as far as what plan. The next one is a pharmacy example, and in this case it's Humalog. So the total for the script is $543.94. That drug is actually on the optimum value list. So if you're on the high deductible plan, the deductible doesn't apply. You only pay the 10%. So in this case, it's cheaper on the high deductible plan. And you can just use your HSA when you pick up the prescription. Okay, let's talk tools. This is the best part. How many have an account on Regions.com? Good. That's good. It has a wealth of information, everything healthcare related. This is the dashboard, so once you log in, this is what it looks like. The first thing you're going to see is how much you met towards your deductible and out of pocket. You actually have an electronic image of your card. You can chat with customer service. You can see all your claims as soon as we put them into the system. It usually takes about an average of 30 days to process claims. As soon as they're final, you can see how much we pay and what you are responsible for before you get the EOB, the explanation of benefits, in the mail. You can actually look at it online, and it's a lot faster. Like I mentioned earlier, you can log in and look at compare costs Once you logged in, it's based on your benefits. So if you met your deductible and you're looking at an ACL repair, it's going to tell you the cost based on your benefit that you met the deductible. It's only going to show the 10% or the 20% on the traditional plan. So take a look at it. Yeah, question?
But your deductible is accumulated, it's not cash, correct? In other words, for example, I had a procedure in May, okay? And I checked all year long if I owed anything. Nothing. And then exactly 2 weeks before 1 year was up from May, I get an $8,000 bill in the mail from IHC that says, yeah, we took it out of your deductible way back when, but we never billed it because we have 1 year to bill at IHC. So all of a sudden I get an $8,000 bill that I wasn't planning on because for a year I was paying and I've got zero bills.
Correct. So he got a bill at the end of the plan year because provider has a year to file a claim. Usually they file a lot faster because they want to get paid. There could be instances where a claim is held up for coordination of benefits, subrogation. We can't control when the provider bills, but the claim is based on date of service when you actually went in. So yeah, if you get it, you can actually get it in the next plan year, but date of service was for the previous plan year, so it's going to be based on your accumulator in that plan year. So it's all based on date of service.
So it's always accrued,
Always date of service when you have it. Yeah.
not based on cash basis.
So yeah, I mean, that's something to think about. But I usually check after I go to the provider, a week or two after, I just make sure we have the claim, and then I watch it to make sure it processed correctly. And then I match it up with a bill from the provider and make sure it matches what the claim processed. That's the best way to do it. But anyways, if you don't have a login, I do recommend set up a username and password, have your ID number ready. It's pretty easy, just walk it through. Find a doctor or estimate your costs. I've talked about it before. It's a great feature. Log in, look at it. You can look at member reviews. You can look at all the different providers' locations, if they accept new patients. So take a look at it if you're having any procedures. Telehealth through MD Live, we've talked about it. It's a great feature. It's a good cost savings for you. Just remember, this is not like a nurse line that can actually prescribe you medicine. I have a coworker who had twins and they had pink eye. The doctor came on board a few minutes, gave a prescription. Second one, 10 minutes, she Skyped, and it was done. They're actually doctors, and it's for your kids too. And if you registered during the open enrollment, you can win a Fitbit or a gift card. So do take advantage of it. You can do it, download the app from the App Store, MD Live, or go to regents.com, and on the dashboard, click on MD Live, or go to the app or the regents.com and click on MD Live. These are just some of the common issues that you can use it for, but definitely take advantage. It's a great benefit. You also have access to Baby Wise, which is a pregnancy tool app. It will walk you through the pregnancy stage by stage. We have access to a nurse 24/7 if you wake up in the middle of the night and not sure about your symptoms. And you can download the app, you can call to register. It's a great feature, a great product. Medical supply, DME, durable medical equipment, is very expensive. So Regents has created a shopping tool online. So if you log in and click on medical supply, it's going to take you to Amazon, and you can actually search for CPAP, crutches, breast pump. Once you purchase it, you can go back to regents.com and file a claim, and that claim will be processed towards your in-network benefits. And Amazon, I guarantee you, is going to be a lot cheaper than any DME provider. So this is a great feature. Take a look and see if you need any durable medical equipment. Take a look and see if they have it, purchase it, and it will just process towards your benefits. Question?
What are the benefits for the durable, what benefits do you offer for the durable equipment?
She's asking what benefits we offer for DME, durable medical equipment. It would just process towards your benefits. If you're on the high deductible, it's going to be deductible coinsurance, and the same for the traditional. It's just going to be towards your benefits, your deductible amount, and your out-of-pocket.
I think she's asking like what percentage do you pay versus.
Right, yeah.
Yeah, so it will be after deductible 80-20 on the traditional, 90-10 on the high deductible. Yeah. So it will be like if you go to a DME provider and you get it shipped to you from Alpine Home or whatever, it's the same thing. It would be the same thing. It would process the same. It's not a separate benefits. It would just process towards your benefits, the DME benefits. Yeah.
But you're saying that Amazon is usually less expensive than some of these DME?
Correct.
Okay.
Yeah. I guarantee you they're going to be cheaper.
I didn't want to make you say that, but yeah.
No. This is, I mean, we're trying to control costs, right? Healthcare is expensive, and this is another option that we're doing for our members, for them to, you know, to pay less out of pocket. So it's definitely a benefit to you, so check it out. How many have the Regions app on their smartphone? Not as many. I do recommend downloading it. It has everything that the website has, but you don't actually have to carry your card because there's an electronic image of your card. And if you have kids who's out of state or in college, have them set up a username and password, and then they can have their own card on the smartphone. EUBs are on there. You can chat with customer service, claims, you can find a provider, everything. So, and it's pretty user-friendly. So it's the same username and password as the website, so it's pretty easy to download and log in. Any questions? Yeah.
So what if you were on value care and like I used to use the hospital, it was an emergency, what happens?
So healthcare reform says we have to pay emergency the same in and out of network. If you get balance billed by an out-of-network facility or a doctor, contact customer service. There is a process in place that they will go through to see if we can negotiate the charges. Yeah.
You cover choking,
As far as the diagnosis,
choking, and you went to an out-of-place hospital.
so it's not like if,
The answer is, I was at Lagoon,
uh-huh,
got a chicken bone.
Oh,
got
no.
in my throat.
okay,
They took me to Davis,
uh-huh.
Davis County, or Davis Hospital, nothing was covered because I was out of network.
So it's covered.
And it said in there,
Uh-huh.
we do not cover choking in your policy.
I can take a look at that. I have a hard time believing we don't cover choking. It's not, we don't have diagnosis that's excluded in our policy. Everything is based on medical necessity. Now, if something goes out of network, doesn't mean that it wasn't covered. It's not covered as good if it's elective surgery. If it's ER, it's paid the same in and out. But again, they can balance bill you, and if they do, call customer service. There's a process in place. But we don't have certain diagnosis that's not covered. There's something that are excluded. But if it's emergency and it's medically necessary, it's going to be covered. Yeah.
It wasn't.
We can definitely take a look at it after. I don't want to keep everybody.
That's fine.
Yeah, go ahead.
I do have a question about, you covered the office urgent care visits and all of that, but what is the emergency visit, cost?
The table has a benefits summary of the plans. I can't remember exactly. The high deductible is going to be deductible coinsurance. Everything is deductible coinsurance. Do you remember, Christy, the ER for the traditional?
I believe it's 20% after deductible and
So there's not a set, like, emergency, because there's a 25 for office, urgent care 35,
I-
specialist 35.
there's not a copay, it's just like.
Yeah, so for the traditional plan, it's also deductible coinsurance for ER. Yeah. Yeah, go to the table at the fair. I have benefit summaries. I have all this material that I'm talked about. So definitely take a look at the fair. Did we have another question? Yeah.
My question just was, who defines what an emergency is? So you say that an emergency room visit is covered regardless of the hospital. So, for example, my son's on his skateboard and he trips and he bangs his face in and we deem it as an emergency.
No, she's asking if we're going to deem that something is not emergency. No, we're not going to go through and say, you know what, I don't think Christy's arm was really broken. She should have gone to the urgent care. No, no. It's going to be in your best interest not to go to the ER because it costs more money, right? It's going to be in your best interest to do urgent care if you can do MD Live because ERs are expensive. You walk in there and it's $1,000.
But any ER that we go to is covered in network.
Correct, yes. But if you get balance billed by an out-of-network provider, contact customer service. Yeah. Yeah, you're welcome. Can we take it after, or do you want to?
This is a quick one.
Yeah.
Just biplane and helicopter, are they both covered?
Yes, yes,
Okay,
yeah.
thank you.
Ambulance by air, it's emergency, yes. It's the same emergency, has to be covered the same in and out of network, and that goes for ambulance and helicopters, and if you have to be transported, yes. Okay, I'm going to turn it over to Laura, who's going to talk to you about a diabetes program that you have available July 1st called Livongo. Thank you, guys.
Hi everyone, Laura Wetley from Livongo, and I'm here to talk to you about the partnership we have with Regents through and offering it to Salt Lake Community College, and it's our Livongo Diabetes Management Program. So this program is going to be available to all Regents members who have diabetes effective July 1st, and there will be a communication sent out starting in July on how to enroll in the program. So just to give you a little bit of information, and this is what you'll receive actually, this is our welcome kit. It includes a meter and test strips. I'm actually in the health fair all day today and happy to show you more about the actual meter. But what the program is it includes a cellular enabled blood glucose meter. So the fact that it's cellular enabled means that the data, anytime you do a reading, that actually automatically uploads to our system. And what that enables us to reach out to you, if you do have diabetes and have an extremely low or really high reading, one of our CDD educators, so that's our certified diabetes educators, will call and ask if you're okay. And they'll also provide some quick tips and ways that you can get your blood glucose back in range. You're able to change those settings as well, but it's a really great solution to provide the support you need right in that moment. The other piece of it is that we offer test strips. They're unlimited and they're included in your plan, so this program is covered at no cost to you. And then the last piece is, just with our coaching, you can, like I said, if you would like them to outreach to you, also when you do a blood glucose reading, your meter will display a message to you, and that message may be ways that you can get your numbers back in range, or if your numbers are in range, it will confirm that. You can schedule coaching sessions as well if you would like, so you can work with a coach and talk with them about nutrition or other things like that. So that's really just a high-level overview of the program, and like I said, communications are going to go out starting in July, so you'll get information on how you can actually enroll in the program, and then just remember that it is covered as a part under your medical plan, and it's no cost to you for the program. I'm across in the Student Center for the Health Benefit Fair, and I'll be happy to show you a demo and a little bit more about the solution if you'd like. Any questions? Alrighty, thank you.
All right, thank you all for coming. That is the end of the presentation. If you have any questions, Elizabeth and I will be in the front. Stephen is back at his booth at the Benefits Fair, so if you have questions about the HSA, FSA, he is over there. Other than that, thank you for coming today.